Hello, everyone. My name is Sarah Baker, and today I will be presenting to you on my IRB proposal, which is looking at if 10 minutes of sun exposure and the effect it has on lupus symptoms and vitamin D levels. So we'll start off with our research question, and that is, can 10 minutes of direct sun exposure 5 days a week decrease vitamin D deficiency and symptoms in lupus patients? That brings us to our hypotheses. So first, the null hypothesis is there will not be a reduction in the prevalence of lupus symptoms in those who spend 10 minutes in direct sunlight. Our alternate hypothesis is there will be a reduction in the prevalence of lupus patients in those who spend 10 minutes in direct sunlight. So that brings us to our background. So a little bit about lupus and vitamin D. So lupus is an autoimmune disease, meaning that the body attacks itself. Its own immune system attacks the body, and this causes systematic inflammation. And because it is a systemic disease, it can affect any part of the body. There's a wide range of symptoms that they can experience. And this includes muscle and joint pains. They can have fever, hair loss. They develop photosensitive lesions when they're in the sun. They can have chest pains, especially when they take deep breaths. They can have kidney issues, including high blood pressure. They can develop sores around their mouth. Oftentimes they're very fatigued. No matter the amount of sleep they get, they're just often very tired. They can develop anemia, eye issues, including eye rashes or swelling on their eyelids. And then they also can have some cognitive issues as well, including memory issues and inability to focus. And why is vitamin D so important? And it's because 93% of lupus patients are deficient in vitamin D. And this is an important statistic because vitamin D is an important vitamin and hormone, and it plays a role in calcium absorption, cellular growth, brain function, and immunity. And then those who are deficient in vitamin D can develop hypocalcemia or low calcium levels. And then they can also have osteopenia as well, meaning they have very brittle bones and they're at higher risk for a bone fracture. So looking at our literature review, so vitamin D deficiency has been shown to exacerbate the symptoms that lupus patients are experiencing, and then it also increases the incidence of lupus. So the cause of lupus isn't known. However, those who are deficient in vitamin D do have increased incidence of lupus. Conversely, those who who have adequate vitamin D in both the lupus and general population have decreased joint pain, which is one of the common symptoms of lupus. So the current treatment for vitamin D deficiency is 50,000 IUs of vitamin D per week, or 6,000 IUs per day for 8 weeks. And this is the same in both the general population and those with lupus. 90% of the vitamin D that we have in our body gets synthesized from sunlight. And one study found that exposing 18% of your skin, so say you're wearing a t-shirt and shorts would be appropriate, for just 5 minutes, 2 to 3 times a week, will provide the body with 10,000 IUs of vitamin D. Another study looked at latitude and vitamin D absorption or synthesis, and they found those below the 37th degree latitude had higher synthesis of vitamin D. And we'll get into this later, but the study will be taking place in Arizona, which has a latitude of 34 degrees north, which is below that 37-degree north point that we are looking at. And then lastly, because we are looking at a study that is outside, we want to determine what is a safe amount of sun exposure for the participants. And a study found that being outside for 30 minutes or less without SPF is still considered safe with minimal risk of developing a sunburn. And this is also a safe amount of time for lupus patients to be outside without developing the skin lesions. So why are so many lupus patients deficient in vitamin D? So there's actually a couple reasons. So one study found that even those who were taking an adequate amount of vitamin D supplementation were still deficient in vitamin D, and that's because their bodies increase the breakdown of vitamin D, so they just weren't getting enough from the supplementation. Another huge reason is that lupus patients develop those photosynthesis lesions, which causes them to oftentimes not go outside, or when they do go outside, apply very heavy SPF. So they're just really not getting enough vitamin D from the sun. Next is the medication that they take. A common medication for lupus is corticosteroids, and this medication has been known to decrease vitamin D absorption. And lastly, it's just their food choices. So one study looked at the typical diet of a lupus patient, and they found that it was very low in eggs, cheese, milk, fiber, and like fruits and vegetables. And a lot of these food choices that they were low in are very high in vitamin D. So they just really weren't getting enough vitamin D from their food choices. So next we're going to look at the participants for our study. So for the study, we will need 66 participants, meaning 33 in each group, the control and the experimental. And this number was found by running a priori difference between two means test in the G-Power software, and then taking that number and then timesing it by a 20% attrition rate. So those to be included in the study will be healthy adults between the ages of 18 and 64. They need to have a lupus diagnosis, live in Arizona where the study is taking place, and they have to have a healthy BMI of 18.5 to 24.9. They will be excluded from this study if they have any other chronic diseases like diabetes, heart disease, etc. If they have any active photosensitive lesions, they will be excluded because we don't want to exacerbate the lesions that they already have by spending time in the sun. And then lastly, we're going to have, they can't have any past medical history of skin cancer, because this is a study that is showing the participants in the sun, so we don't want to increase the risk of relapse. And lastly, we're excluding overweight patients because obesity has been shown to decrease vitamin D absorption. So next we're going into the methods. So the participants will be gathered from a local clinic that they're already going to for their lupus treatments. And then there will be a sign-up sheet at the counter where they sign in. That provides them information about what the study is and a safe place for them to drop their contact information if they are interested in the study. So some preliminary testing that will be done is they will have their 25 hydroxy vitamin D levels tested to see if they are deficient in vitamin D or not. It will be done at their local clinic, and they will also fill out a questionnaire that details any symptoms that they're having, and then also they will fill out a Likert scale on the pain and symptom severity. At this time, the past medical history will also be obtained, along with BMI, age, to see if they are appropriate for this study. So the actual intervention, the participants will spend 10 minutes outside 5 days a week with 18% of their skin exposed for 8 weeks. Before and after the testing, they will have their 25 hydroxy vitamin D test done, which is a blood draw test to see if there's any improvement in their vitamin D levels. And then they will also fill out a post questionnaire along with having their pain symptoms ranked to see if there's any improvement. So going into a little bit more of the details for the intervention. So this intervention is 8 weeks long, which is the length that it takes for typical vitamin D treatment to last. And then they will download an app on their phone, and this app will track the UVB rays for that day. Also, it will set a timer on their phone for 10 minutes. And this timer will tell them to either go inside or apply SPF at this point. Studies have actually been done with specifically looking at apps and and skin cancer, and they found people who download an app on their phone that tell them to apply SPF have decreased risk of skin cancer, which is where this concept comes from. So this study will have the participants spend 10 minutes outside with 18% of their skin exposed, so a shirt and t-shirt. And this will be 5 days a week, and this should yield the 50,000 IUs of vitamin D which is the same amount and length as current treatment for vitamin D, but the only difference is we're looking at sun exposure versus supplementation. Um, so this study will be done in Arizona, which is at the 34th degree north latitude, which is below that 37 degrees north that we're looking at. It will be done outside between 10 a.m. and noon. And this is to give optimum UVB exposure. But because it's so hot in Arizona during the summer, which this is taking place in June and July, we shifted the time to the morning so it's not as hot. So when looking at the results, we are looking at the serum 25-hydroxy vitamin D levels and then also their symptoms. So we are hoping to see an increase in the vitamin D serum levels, and this should be increased to 20 ng per dL, which is considered the normal amount of vitamin D serum levels. And then this will be ran through a post hoc t-test in the G-Power software to determine if our findings were statistically significant or not. And then we're also looking at their symptoms as well. So they will be asked to fill out a post questionnaire that pertains to what symptoms they're having, the severity, and then also filling out this on a Likert scale as well, which will provide us qualitative data from the open-ended questions that we're answering them and some more quantitative values from the Likert scale. So next we're going to look at the privacy. So at the start of the study, the participants will be informed of what the study looks like, any risks that they'll be put in, and then they'll have 2 weeks to review this, consider the possibilities, and then they will be given a consent form, which is downloaded from the IRB website. And this is giving consent to participate in the study, using and gathering their data along with a consent form for the blood draw for the vitamin D levels. All members of the study will have training done, which will entail how to safely handle protective information to ensure that there's no breaches, which include turning off your computer when you're not at it, how to safely handle information so it's not exposed to people outside of the study, and then also software will be downloaded on all electronic devices to prevent any hackers from gathering information. And then initially when they're putting their contact information, when they're interested in the study at the clinic, it will be dropped into a locked drop box that people cannot access without a key. So that does bring us to our conclusion. If this study is a success, it provides a safe, cost-efficient way for lupus patients to overcome their vitamin D deficiency and have some relief from their symptoms as well. This should improve their quality of life as it decreases the amount of pain that they're in. And then along with that, it decreases their financial burden as well, because they're not paying for costly vitamin D supplements that really are not that efficient. And then hopefully if they're in less pain, they have to spend less money on pain medication as well. And if this is a success, hopefully we can apply this information to other disease states that have photosensitive skin, and hopefully help those patients overcome vitamin D deficiency as well. So there are a couple limitations to this study. The first one just being that it's taking place in Arizona, which is known for its extreme heat. This summer it's gotten up to 118 multiple times a week. So if the high heat may increase the attrition rate if participants don't want to spend that time outside. Along with that, July is monsoon season, so there's increased risks of showers and overcast days, which can hinder the ability to test the study. Lastly, we want to talk about future research. If this is a success, we want to see if it can be applied at different latitudes, maybe above that 37 degree north line, or if it is effective in other seasons, because winter is known to have decreased vitamin D synthesis from the sun. So we want to see if this can be replicated in all months of the year, not just June and July. I appreciate you listening to my IRB proposal, and I hope you have a great day. Here are my references.